Welcome once again to our Oxford Brain Diagnostics guest speaker series. More today. So as an imaging-based company, we look forward to discussing the value of biomarkers, including imaging in the drug trial space. And I think the subject of your talk, Eric, is innovations in AD trial design using Acumen's Intercept AD trial as a case study. So over to you.
Great. Well, thanks for the introduction. Again, I said for us and our go, no-go decision, we need to have the first three here: the safety and tolerability, PK, evidence of target engagement. And if we get those three things, we can go on to a phase 2-3 study. And I'll talk a little bit about that too. Now, again, the extra things that we're doing, we're going to look at things like CSF and now plasma phospho-tau, things like neurofilament light. Those things will be important for the phase 2-3 study. I think in the MAD part of our phase 1 study, people get 3 administrations of the antibody. It's a little hard for me to believe that 3 administrations will affect those things, but we'll look mostly so we get experience with the assays before we go to the phase 2-3.
Thanks, Eric. That was a very nice overview, both of the kind of underlying logic and biology and some of the history of trials in this area.
Hi, yes, thank you so much for your great talk. So, you know, you're saying that sort of one of the strengths of this approach is that it's easy to do it later on, and you're sort of talking about the issues that arise from having too restricted a patient segment. But surely it is the idea that these drugs would be used much earlier, but would we have to have a trial where truly early, 10 years pre-symptomatic patients were actually in the trial before we would be allowed to use these drugs?
Yeah, I think you definitely would. And there are studies that are ongoing. And so even though I said, that there's some complexity to the study designs there, those things are being worked out, and it's the best possible thing you could do is prevent any cognitive decline, right? So sort of fast forward, I don't know, 5 years, maybe 10 years, maybe hopefully less. But if we've got good plasma biomarkers, that could become a screening test like you get your cholesterol tested. And, if a screening biomarker was positive, then maybe you would go on and have a PET scan. Maybe, maybe the plasma biomarkers get so good you can skip the PET scan. I mean, people have talked about that. Maybe, and I should have commented on this too, an MR with, you know more about this than I do, but with these new sophisticated techniques that are being developed, I mean, that could certainly, play a role in an evaluation.
Thank you very much, Dr. Siemers, for your time today. I think that we've all enjoyed the time that we had for Q&A, actually, and thank you for your presentation that allowed plenty of time also for that. So I'm sure we'll talk again, but for our guest speaker series, thank you for taking part.
Well, thanks very much. Just a great discussion.
Thank you, Dr. Siemers.
Thank you very much.
Bye.
See you again.